Welcome to Lecto. Today we are going to discuss thalassemia. Thalassemia is basically a disease in which there is an imbalance between the alpha and the beta globulin chain of the hemoglobin. This disease is actually first discovered in the people who lived near the Mediterranean Sea. So on the basis of this, we called it thalassemia. Thala means sea and anemia means blood. It has two types, alpha thalassemia and beta thalassemia. If there is a reduction or dysfunction in the alpha globulin chain, then it is called alpha thalassemia. If there is a reduction in the beta globulin chain, then it is called beta thalassemia. In this lecture, we will discuss in detail the alpha thalassemia. Let's start. First of all, we will discuss the normal types of the hemoglobin which is present in the human body. So, first of all, hemoglobin present in the fetus and the hemoglobin present in the adult. Fetus has hemoglobin HbF. This is the fetal hemoglobin. Adult has three types of hemoglobin. Hemoglobin A, hemoglobin A2 and hemoglobin F. These are the hemoglobin which are present in the adult. HbF has 2 alpha and 2 gamma globin chain in the hemoglobin. Hemoglobin A has 2 alpha and 2 beta globin chain. A2 has 2 alpha and 2 delta globulin chain, and F has 2 alpha and 2 gamma globin chain. But the important hemoglobin is the hemoglobin A. This is actually present in large amount and it's play an important role in the body. And you will see that all hemoglobin has alpha globin chain in it. So it's mean alpha globin chain is important in the formation of all these hemoglobin. Globin are basically the protein, and its formation, the instruction of its formation comes from the DNA. So DNA is actually involved in the formation of these globulin chain. DNA actually convert into the RNA. RNA convert into the protein. In this case, what type of protein? Globulin chain. So you see that there are two chromosomes. Chromosome number 16 and chromosome number 11. This is the chromosome number 11. Chromosome number 16 has 2 alpha gene, alpha 1 and alpha 2, and total alleles 4 alleles. Alpha 1 gene has 2 alleles on the homologous chromosome, and alpha 2 has also 2 alleles on the homologous chromosome. And on the chromosome number 11, there is a beta gene which has 2 alleles. So these are basically the genes which are present on alpha genes on chromosome number 16 and beta genes on chromosome number 11. Keep remember that the beta genes result in the formation of 2 beta globin chain. 2 beta globulin chain will produce by the beta genes, and 2 genes of alpha genes involved in the formation of again 2 alpha globin chain. 2 genes are involved in the formation of 2 alpha globin chain. But in case of beta, only 1 gene is involved in the formation of 2 beta globin chain. So this point is very much important. In the formation of alpha globulin chain, you require 2 genes having 4 alleles. And in the formation of 2 beta globulin chain, you require 1 gene having 2 alleles. So we will discuss it with the help of graph. You see that on the x-axis there is a gene, and on the y-axis percentage of alpha and beta globin chain. So you see that the 2 beta gene and 4, you can say, allele. 2 beta allele and 4 alpha allele. 4 alpha allele and 2 beta allele. And these allele are normal, and it result in the 100% formation of the globulin chain. So you see that it result in the formation of 100% globulin, beta globulin chain and 100% alpha globulin chain. If the one allele is defective, 4 allele, alpha allele is present, if there is a defect in, or if there is a deletion or defect in one allele, then the remaining allele will be alpha 3, and here you see this is the beta 2, which is remain the normal. Quantity of beta remain the normal, but the alpha, the quantity of the alpha will reduce because one allele is defective or mutated. Next, beta 2 remain the same, but the alpha allele deleted or mutated, and remaining will be alpha 2, and again it result in the reduction in the quantity of the alpha globulin chain. Again beta will remain the same and alpha will reduce to alpha 1. A further reduction in the quantity of the alpha globulin chain occur. And last, again beta will remain the same, but now there is no alpha allele is present. In that situation, there will be no alpha globulin chain. So this is the case. Normal alpha A4, 4 allele are present and quantity will remain the same. But with the passage of time, allele will reduce and it result in the reduction of the alpha globulin chain. So first two condition, when the A3 and A2 are present, this is actually called the trade. When only the one allele is present, then it is called HBH disease. This is called HBH disease. We will discuss it later. And when there is no alpha gene, then it is called Hydrops Fetalis. Hydrops Fetalis. Next we will discuss it in detail. Classification of alpha thalassemia include, first one is the thalassaemia minor, or you can say trade, thalassaemia trade. Second one is the thalassaemia intermedia, or it has another name which is called the HBH disease. HBH disease. And third is the thalassaemia major, and it is also called Hydrops Fetalis. These are the three categories of the alpha thalassemia. In alpha thalassemia minor, or you can say trade, it has two categories. You see two categories of the minor, thalassemia minor. Alpha positive trait and alpha not trait. What actually the difference between alpha positive and alpha not? The basic difference, keep remember that there are 4 alleles which are involved in the formations of the alpha globulin chain. You see that here are the 2 genes, gene 1 and gene 2. This box is for gene 1, this box is for gene 2. When there is a defective one gene, here is a defective gene, but other genes will remain same. These are the normal genes. So you see that Gene 1 has one defective allele, other will remain the same, normal allele. Gene 2 has both normal alleles. So, when there is a defect in one gene, I'm talking about one gene, then it is called alpha positive. And when both the genes are defective, then it is called alpha not trait. So in that situation, only the alpha 1 gene is defective because one allele in it is defective. The second case is that this is the gene 1 and this is the gene 2. In that situation, if both the alleles of the genes 1 is defective and the gene 2 has normal allele, so you again see there is again only defective the gene 1, but again gene 2 is normal. So this is also fall in the alpha positive trait. But in that situation you see alpha 1 gene has two allele, one defective and one normal. This is different case. So on the basis of this we call this hetero alpha positive trait, in which both the alleles are different. One is normal and one is abnormal. In the second case, you see that alpha 1 has defective alleles. This is the case. But in that situation, both the alleles are defective. This is the same case. So on the basis of this, we call this homo. Homo is actually the case in which both the alleles are same, defective. So on the basis of this, we call it homo. This is hetero, one is defective, one is normal. And this is homo, both the alleles are defective. So this is the alpha positive trait. If we move toward the alpha not trait, in which both the genes should be defective. In this case, you see that there is the alpha 1 gene and this is the alpha 2 gene. In this case, alpha 1 gene has one defective allele. Alpha 2 gene again has another defective allele. And they also have normal allele in it. So in this case, you see both the genes are defective because in both the genes one allele is defective. So in this case, we call this alpha not trait. And this is actually the heterozygous condition. You see that this is the heterozygous condition, because in this case both the alleles are different. One is normal and one is abnormal. So hope so you got the point that alpha positive and the basic difference between the alpha positive trait and alpha not trait. Keep remember, if there is the defect, if only one gene of the alpha, then it is called alpha positive, and if there is both the genes are defective, then it is called alpha not trait. So this is the thalassaemia minor, or you can say thalassaemia trait. And in this case, you will see MCH and MCV will be low in case of thalassaemia minor. Next, if we move towards the thalassaemia intermedia, or you can say HBH disease. In this disease, you will see there is a defective. Up till now, we discussed the defect in two alleles. In HBH disease, there is a defective 4 allele. You see that this is the gene 1, this is the gene 2. Gene 1 has 2 defective alleles. Both alleles are defective. But gene 2 has one defective allele and the other allele is normal. So this is the case of intermedia, thalassaemia intermedia. In this case, you see gene 1 has 2 defective allele, and gene 2 has one normal and one abnormal allele. And you see that on both the genes are defective. So can we say that this is alpha node? Because both the genes are like this one. Both genes are defective. And in positive case, one is defective. There is an only defective one. But in that situation, both the genes are same here. Both the genes are defective. So we call it alpha node. And you see that there is a normal and there is an abnormal allele. So this is the case. This is actually similar to that. One is defective and one is abnormal. So can we say it alpha positive? So this is actually the compound condition. This is called compound heterozygous. Alpha not and alpha positive. This is the thalassaemia intermedia, and this is the compound heterozygosity. In this disease, you will see that HbH hemoglobin. On the basis of this, we call it HbH disease. HbH hemoglobin is abnormal. We discussed these hemoglobin, these are normal hemoglobin, but HbH hemoglobin is abnormal. It has 4 beta. It has 4 beta globin chain. Why it happens? Keep remember that the fetal hemoglobin, let's say HbF, convert into the HbA. This is the case. Fetal hemoglobin has 2 alpha and 2 gamma, and adult 2 alpha and 2 beta. We have also discussed in the previous lecture that the gamma globulin chain convert into the beta globulin chain. This is the conversion, and this conversion is occur in the first month after the birth of the baby. First month, you will see, after the first month, you will see that the conversion of the gamma into the beta. So in that situation, there is a reduction in the alpha globulin chain. Here you see that this is the case, HbH disease, reduction in the alpha chain. And before the birth, the alpha chain reduced, and the alpha chain in the fetus state, alpha chain will combine to the gamma, and it result, and they will compensate with the gamma. But when they start converting into this one, beta, then there will be no alpha globulin chain available to the attachment of the beta. So on the basis of the beta will remain separate. So on the basis of this, beta will combine together and form the 4 beta globulin chain. I repeat that alpha, this is the case, alpha is reduced in the intermedia or HbH disease. Let's pause. Instead of 100%, alpha globulin chain will remain 50%. 50% alpha globulin chain is present. This 50% alpha globulin chain will combine with the gamma in the fetus state, because fetus state is first next to the adult state. In case 50% alpha globulin chain combined with the gamma, and next when the gamma convert into the beta, then the alpha globulin chain will not be available for the attachment of the beta. So in this case, beta chain will remain separate, and they combine together and form the 4 beta globulin chain, and it result in the formation of HbH disease, or you can say hemoglobin H. In this disease, you will see that microcytic hypochromic hypochromic anemia. What type of anemia you see? Microcytic and hypochromic anemia in the case of the intermedia or HbA disease. Other MCH, MCH and MCV will be low in the HbA disease. And you can diagnose is by two ways. First, in the microscopy, when we use supravital stain. First is the brilliant crescile blue, and second one is the methylene blue. You will use two stain, brilliant crescile blue and the methylene blue, and you will see actually this is a red blood cell, and in the red blood cell you will see that there are lot of HbH hemoglobin present in the red blood cell, and this is actually look like golf ball. So this is the case when we use these stain and look the RBCs, then the RBCs will look like golf ball because the lot of HbH hemoglobin present in the RBCs. And RBCs can also change its shape, and they can also be look like target cell. In some case that the RBCs changes shape, normally the hemoglobin present at the periphery of the RBCs and central area is pale. But in the target case, that here you see, this is the RBCs and the hemoglobin is present at the periphery, but some hemoglobin are present at the center. So this is actually look like the target. So we call it target cell. In target cell, some hemoglobin present at the periphery and some present at the center. Normally, hemoglobin present at the periphery, central area is pale. So you can also see the target cell in the HbA disease. Last is the Hydrops Fetalis or thalassaemia major, and it has two gene 1 and gene 2, and both the genes has defective or deleted allele. So it results in the formation of no alpha globin chain, and this is not a survival condition. In the uterus, fetus will die because this is not the survival case. In that situation, baby cannot survive in the thalassaemia major, or you can say Hydrops Fetalis. And in this case, you will see what type of hemoglobin? HB barred. What type of hemoglobin? HB barred hemoglobin. In this hemoglobin, you will see four gamma globulin chain. 4 gamma globulin chain. See, in the fetus state, when there is no alpha globulin chain, then what will happen? That all the gamma globulin chain is present, and there is no alternative and there is no attachment site for the gamma. So in this case, all the gamma combine together and form the HB barred hemoglobin. HB, in this case, all the 4 gamma globulin combined because there is no alpha is present. So in this case, you will see the barred hemoglobin and gamma 4. And again, you will see that in this case, MCV and MCH will also highly reduce in this case. And last is rare case. Up till now, we will discuss the defective or the deleted allele. In some case, when the alleles are dysfunctional, alleles are defective, two situations can happen. First is the allele is deleted, and second is the allele is defective. If the allele is deleted, then there will be no globulin chain. But if the allele is defective, then sometimes globulin chain can produce, but it is actually unstable globulin chain. In this case, you will see that the hemoglobin constant spring. What type of hemoglobin you will see? Hemoglobin constant spring. In this case, the globulin chain are basically defective, and this is unstable case. And last is the neurological abnormalities. In thalassemia, you will also see the neurological abnormalities in which the intellectual level of the individual is lost. First one is the ATR16 and second one is the ATRX. Alpha-thalassaemia mental retardation syndrome. This is the alpha-thalassaemia mental retardation syndrome, and this is again the alpha-thalassaemia mental or intellectual disease. This is actually caused by the mutation or the deletion in the chromosome 16, and this is actually, if the deletion occur in the X chromosome, then it results in the ATRX disease. In this case, the genes which are involved in the formation of the globin will be deleted. It can also include the alpha genes. So if the alpha genes are deleted, then it can also result in the ATR16 syndrome. And if the genes cluster is deleted, which include the alpha gene, then it can also result in the ATRX. And this is X. In this case, only the males are affected by the ATRX disease, because male has XY chromosome and female only has XX chromosome. In that situation, the dominant X is dominant. In that situation, in case of male, there is only X chromosome and it will actually represent properly. But in female, it is actually carrier state. So in this case, ATR is only you will see only in the male, because it is prominent in male. But the female can also carry, not the disease or the symptoms will appear in the female. So this is the neurological abnormalities which are mostly seen in the alpha-thalassaemia. So this is all about the alpha-thalassaemia. If you have any question, then you may ask in the comment section. Thank you.